This video sponsored by BuyMote shopping app. BuyMote e-shopping application is one of the online shopping app now available on Play Store and App Store.
Hi guys, if you are in nursing competitive exam preparation, then you can join with me for practicing previous year MCQs. First question is hormone that increases water reabsorption by inserting water channel or aquaporins in. Options are option A ANP, option B aldosterone, option C ADH, option D angiotensin. This question correct answer is option C ADH antidiuretic hormone. Major function of ADH is increase retention of water in body by increasing aquaporin 2 channel in the renal collecting duct of kidney. ADH act on distal convolutal tubule of nephron and increase water reabsorption and bringing back into circulation. ADH at large dose also causes constriction of arterioles, so rising blood pressure and increases level of clotting factor 8. Question is the growth hormone or somatotropin is secreted by which of the following gland? Options are option A adrenal gland, option B testis, option C hypothalamus, option D pituitary gland. This question correct answer is option D pituitary gland. Hypersecretion of growth hormone for adult called acromegaly. Hypersecretion of growth hormone for children called gigantism. Third question is where is oxytocin synthesized? Options are option A para-axial nuclei of the hypothalamus, option B hypothalamo-epiphyseal plexus, option C paraventricular nuclei of hypothalamus, option D hypophyseal portal plexus. In this question, correct answer is option C paraventricular nuclei of hypothalamus. Oxytocin is secreted by posterior pituitary in paraventricular nuclei of hypothalamus. Major function of oxytocin is help to expel the fetus by myometrial muscle contraction. Fourth question is hormone responsible for milk ejection reflex is. Options are option A progesterone, option B estrogen, option C prolactin, option D oxytocin. Question correct answer is option D oxytocin. It stimulates milk let down by contracting epithelial cells of breast alveoli called milk ejection reflex or galactokinesis. Fifth question is the hormone which stimulates breast to prepare for lactation. Options are option A estrogen, option B prolactin, option C oxytocin, option D ADH. Question correct answer is option B prolactin. It helps into production of milk by breast alveoli. It is high level in the blood during pregnancy, also stimulates the growth and development of the mammary tissue to prepare for lactation. During breastfeeding, due to sucking response on breast by baby, the level of prolactin increasing. Prolactin causes milk secretion reflex. Excess secretion of prolactin called hyperprolactinemia, which causes amenorrhea and galactorrhea in female. For male, erection dysfunction and libido will be decreasing.